Menopause marks a profound turning point in a woman's life, not only reproductively, but metabolically. It is a biological transition characterized by a permanent end to menstruation, but what makes this phase especially challenging for many women is the cascade of hormonal shifts that follow. These changes, especially the sharp decline in estrogen, don't just influence mood or bone density. They play a central role in how and where fat is stored, how well the body handles glucose, and how efficiently energy is used. For many women, menopause is accompanied by an unsettling and seemingly inexplicable weight gain, often centered around the abdomen. Despite eating habits that haven't changed or even become stricter, body fat increases, muscle tone declines, and stubborn belly weight becomes harder to shed. Understanding the underlying mechanisms is critical not just for weight management, but for long-term metabolic and cardiovascular health. The drop in estrogen that accompanies menopause is the primary driver behind these changes. Estrogen isn't just a reproductive hormone, it has widespread influence on fat distribution, insulin sensitivity, and inflammation. In premenopausal women, estrogen promotes a pear-shaped fat distribution, favoring storage around the hips and thighs, areas that are metabolically less risky. But after menopause, as estrogen levels fall, fat storage patterns shift dramatically. Fat begins to accumulate in the abdominal region, specifically around the internal organs, a type known as visceral fat. This isn't the harmless, pinchable fat under the skin. Visceral fat is metabolically active and dangerous. It secretes pro-inflammatory cytokines and disrupts hormonal signaling, increasing the risk of insulin resistance, type 2 diabetes, fatty liver disease, and heart disease. At the same time, declining estrogen levels impair the body's ability to regulate glucose. Estrogen plays a role in maintaining insulin sensitivity, helping cells efficiently take up and use blood sugar. Without its protective effect, blood glucose levels tend to rise, and insulin becomes less effective at driving sugar into cells. This leads to higher circulating insulin, a condition known as hyperinsulinemia, which further promotes fat storage, especially in the belly. Worse, this insulin-resistant state creates a vicious cycle. More fat leads to more insulin resistance, which leads to even more fat gain, particularly in the midsection. For many women, this can occur even if their diet remains constant, leading to feelings of confusion, guilt, and helplessness. But menopause doesn't just shift fat storage, it also slows metabolism overall. Muscle mass naturally declines with age, and the hormonal changes of menopause accelerate this loss. Because muscle is the most metabolically active tissue in the body, its decline means fewer calories are burned at rest, making it easier to gain fat even without increasing food intake. Simultaneously, declining estrogen may alter hunger and satiety hormones such as leptin and ghrelin, leading to stronger cravings, increased appetite, and more difficulty feeling full. Many women find themselves eating more without consciously intending to. These changes are deeply frustrating, but they are not personal failures. They are biological realities that require strategic, compassionate adaptation. And here's the important warning: if these shifts are ignored, they can quickly lead to a downward spiral of metabolic dysfunction. The combination of visceral fat, insulin resistance, and muscle loss increases the risk of chronic diseases that may not become symptomatic until years later. Silent threats like cardiovascular disease, metabolic syndrome, and even certain cancers. Too many women go through menopause without ever being educated on these risks or given guidance on how to counteract them. As a result, the physical and emotional toll can be significant. But there is also powerful, science-backed reason for optimism. While hormonal shifts are unavoidable, their effects are not unmanageable. The body remains highly adaptable, even after menopause. Strategic changes in lifestyle can not only halt the progression of weight gain, but, in many cases, reverse it. The key lies in targeting both metabolic and hormonal factors simultaneously. Strength training becomes indispensable. Building and preserving muscle is the single most effective way to increase metabolic rate and reduce insulin resistance. Just 2 to 3 sessions per week of resistance exercises can make a significant difference in body composition and blood sugar regulation. Cardiovascular exercise also helps, but it must be paired with strength work to prevent further muscle loss. Diet needs thoughtful adjustment, not simply calorie restriction, but macronutrient rebalancing. Increasing high-quality protein at every meal supports muscle maintenance and improves satiety. Reducing refined carbohydrates and added sugars is essential to blunt insulin spikes. Fiber-rich vegetables, whole grains, and healthy fats from olive oil, nuts, and fish help stabilize blood sugar and reduce inflammation. Intermittent fasting, when used cautiously and appropriately, may also improve insulin sensitivity in postmenopausal women. Sleep and stress management must not be ignored. Sleep disruption is common during menopause, often due to night sweats or anxiety, but poor sleep exacerbates insulin resistance and triggers hormonal dysregulation that makes fat loss more difficult. Prioritizing 7 to 8 hours of consistent, quality sleep can dramatically improve metabolic outcomes. Mindfulness, breathing exercises, or cognitive behavioral techniques can also help reduce cortisol, the stress hormone that drives belly fat accumulation. In some cases, hormone replacement therapy, HRT, may be considered, particularly for women with severe menopausal symptoms. While not appropriate for everyone, HRT has been shown to reduce visceral fat and improve insulin sensitivity when used early in the menopausal transition and under careful medical supervision. It's not a weight loss treatment, but for some, it can help stabilize the metabolic chaos that fuels midlife weight gain. In conclusion, menopause is not merely the end of fertility. It is a pivotal metabolic transition that reshapes how the body handles fat, sugar, and energy. The hormonal changes involved are real, profound, and deserving of far more attention than they typically receive. Weight gain during this phase is not just about lifestyle, it is about biology. But with understanding comes empowerment. Women who respond to these changes with targeted action can not only regain control over their weight and health, but emerge stronger and more resilient than before. Menopause may change the rules, but it doesn't take away the power to win the game.